Hey guys, Don here. Welcome to Podiatry Practice Mastery. Yesterday I had an opportunity to interview Tom Hecker, and most of my interviews I do at lunchtime. And this one I did at the end of the day because Tom is 2 hours different, so it didn't really work. He's in Colorado, so it didn't really work. But I did it after dinner with my family. And then the problem was I was so excited. I don't know if it was from that or too much kombucha, but I was really excited about his interview. It had really great content, and I think for some people it's obvious, but for me, I wanted to point out a few kind of action and application things I took from his interview. So number one, for the longest time we've been using actual medical assistants in our office, but we do have more of a sports med practice, and I never really thought about using an athletic trainer, and that's who Tom typically uses in his office to not only probably help with patients, but also since he's doing sports med stuff, he probably teaches them Graston and teaches them other types of modalities like doing shockwave. I knew another doctor that was visiting, Bill McCann. He came to visit me in New Hampshire, and he uses his assistants to do the shockwave. And I think that's a way of maybe even reducing the price or just freeing you up so you're not occupied. I know a lot of doctors. I was talking to Dr. Bromley, for example, in the past, and he didn't do shockwave just because he didn't have time. Because it takes, you do 3 or 6 sessions. That's a lot of sessions. And if you could have a trainer, you can teach them a trainer to do that and have their own kind of schedule. That would be the best of both worlds. So that's the first takeaway. The second takeaway, which is the second time I've heard this, I was talking to Chris Titko. We talked a while back about getting referrals, but one thing that she mentioned is she says, Don, I never talk about prices. And it just made her life so much easier. And Tom, he said the same thing. He has Rhonda, which is one of his probably assistants or office managers, that talks about prices for everything. And I was just thinking, that's so elegant, because the biggest drawback is when we have to talk about these packages, talk about these prices and things like that. And I haven't figured out a good way of doing it in my office, because it seems like the checkout's always backed up, so I don't know if it has to be another person or having someone go into the room, but I just don't have a good workflow for it. But I'd like to know if other people are using staff to talk about that, because right now, one of the, not a big challenge, but I'll talk about shockwave. It's $150 a treatment. We'll do between 3 and 6 of them. But it sounds like what some of these other people are doing, they're kind of presenting everything and then having the staff kind of go over it with the patients, which would be a lot more comfortable, I guess. I could just focus on the medicine and kind of what works best in their condition, and then they can talk to the assistants about paying for it. I think that's a good idea. And then, so those are a couple of things. And then he does a lot of different types of modalities. I looked up Tom Raven. He has a prolotherapy book. I think it's $300 about. But if you think about it, let's say you charge $150 an injection. That might be 2 injections. So it's probably worth it to get the book to see what it's like if you're interested in prolotherapy or getting some of the articles or even going to a course. I find more and more as I get older, it's just easier for me to, because of the kids and things like that. When am I going to have time to read a 300-page textbook? Never, because of kids. And so just going to a course a lot of times is a lot easier. So those were a couple of my kind of big takeaways from Tom. Would be, using your assistants to talk about prices, packaging things. I like his 4-month package versus like a 4-week package versus like 6 or 8 weeks that it might take things. And he has this cool loading brace. I haven't figured it out yet which one he uses. And his lack of using orthotics was kind of a different way of doing things to me. So if you listen to that interview, I think you're going to like it. It probably has a little bit for everyone, and he was very generous in what he shared. So once again, I hope you enjoy that interview. Let me know what you think. I'm also trying to put a few names together for a mastermind. A couple of people have reached out to me. I'm not exactly sure how this mastermind is going to work. I'm probably just going to test it out. We might use something on the website itself. I know they have a way of doing a mastermind on this Kajabi site where I built Podiatry Practice Mastery, or you might just use something simpler like WhatsApp. But I'm not sure how to do it in terms of time, because everyone's in different time zones. Everyone's got different obligations. If we're going to actually meet in person, or if we're just going to do it I would love to do something asynchronistically. So if anyone has any ideas how to do it asynchronistically, meaning, we can pose a question in the beginning of the week and we all kind of contribute to it, or one person talks about a problem. But I was thinking about WhatsApp. That's just an easy way. We can get maybe 5 or 10 people together, all kind of share, help each other with different struggles we're having or ideas. Okay? Anyway, join Podiatry Practice Mastery. Have a great day.